Awesome. All right. Hi, everyone. Thanks so much for joining. My name is Wiggy. I'll be leading this training on the Twin City Hospital Workers Pension Plan this evening. I'm really excited to lead this training. I think the pension is a really cool retirement benefit that not very many workers get access to anymore. I know when I first learned about this job, I was like, I don't even know what a pension is. And so it's been cool part of my journey working for SEIU to learn more about this pension. And the more I've learned, the more I believe in it as a retirement benefit. So yeah, excited to share some more information with all of you so that you all can make the best plans for each of your retirements. Um, all right, so probably the first question is who's currently a part of this pension plan? So I've got a list on the screen here of all of the facilities where we have currently won the pension. And so you'll notice that there's some facilities where some workers have the pension and some other folks don't, especially people who are newer to joining SEIU. Not everybody on this call is on this list, and that's okay. I'm so glad you're here, and we're going to talk more about how people who don't currently have the pension can win this pension benefit. But I want to start with grounding in this so that you can check and see for yourself, am I currently participating in the pension, or is that something that we're gonna have to fight more to win? But either way, I'm so glad you're here, and we'll talk about a lot of things for if you're in the pension, and then also if you're not, how to get into that. So let me just close one thing real quick. So one of the best parts about this pension benefit is that you don't have to pay any money to access this benefit. It's as long as you're in one of the participating facilities, it's a guaranteed retirement benefit for you as long as you fulfill the requirements, but it's not something that you have to pay into. And so a simple definition of a pension, if there's folks on this call who are really new to learning what a pension is it's a retirement plan that provides you with a steady income for life after you retire. So later on, we'll kind of talk more about the difference between a 401k or a 403b retirement plan and a pension plan. But with a pension, what you can expect is when you retire, you will get the same amount of money. You'll get a check in the mail or direct deposited every single month for the rest of your life. So it's a guaranteed benefit. You can depend on it and you know you'll get it every single month. We'll talk more later about how much that benefit is, but essentially the longer you work, the higher your monthly pension amount will be. So I'll show you where you can look up online to find your specific benefit amount right now. But I thought I would start with a little bit of history about the pension, because it's a cool and interesting history about this pension. So this began in 1965, and it was established as the first healthcare worker pension in the entire country. So we're like making history here. And it was established as a Taft-Hartley fund. You don't have to know what that means, but what's true about it is that it's jointly managed with all of the participating employers. So there's a board of trustees who manages this fund, and it's made up of people who work for the employers, folks at Alina or Fairview or Children's or other places like that, and then also SEIU members and staff members as well. And they jointly make all of the decisions about the pension. So, I think it's an important question. We didn't always have this pension. And at some point, we fought really hard to win it. And I think it's important to understand the history of what it took to get this benefit, what it took SEIU members doing to win this pension. And so This was a long, hard fight that took many, many years of SEIU members fighting really hard to get access to the pension. In the 1960s, it was illegal for hospital workers to strike. And so they weren't able to strike to get this pension, but they won it through an arbitration decision, which is still a way that we get wins even now. But there was the official arbitration process that was happening, and then there was all kinds of organizing that was happening on the ground to add additional pressure on our employers to make them agree to this pension plan. And this is a fun photo. This photo is some of the first hospital workers getting their first pension check right after we won the arbitration decision back in 1965. So the first thing I'll chat about in terms of the pension is where does the money come from? Where does the money come from that goes into the pension fund? And the answer is that it comes from our employers, and that's something we negotiate every contract negotiations. So I've included screenshots here for both the Alina contract and the Twin Cities multi-employer contract, which includes Children's, Fairview, Park Nicollet, North Memorial. And essentially what we do every round of contract negotiations is we bargain with your employers, the bargaining team and the employers bargain over how much money is going to be put into the pension fund. And so you can see right here, starting on March 1st of 2025, it just increased so that every hour you all work, 80 cents is put into the pension fund on your behalf. And then starting in 2026, it'll go up 3 more cents to 83 cents an hour. So every time we negotiate these contracts, we have the opportunity to put pressure on our employers to contribute additional money into this pension plan. And that's the best way, that's the best tool that we have to increasing your individual pension benefits is by forcing our employers to put additional money into that each time we do contract negotiations. So I know we're a couple years away from contract negotiations, but I think it's an important thing to be putting into all of our heads right now is when we're thinking about what our priorities are for the next round of contract negotiations, we may want to think about how can we put some more pressure on our employer to get more money into the pension so that when we all retire, we get bigger benefits as part of our retirement plan. So how does one become eligible for this pension benefit? So you have to work at least 870 hours in a year, which is approximately a 0.4 FTE for at least 5 years in an SEIU positions at a participating employer. So I had that list at the beginning of all of the participating employers. You can also find that on our website anytime. And to get the full pension benefit for a year, you have to work at least 1,400 hours or approximately a 0.7 FTE. If you work somewhere between a 0.4 and a 0.7 FTE, you'll get like a partial credit for that year. And it's a lot of tricky, complicated math that goes in, and I'll show you where you can like check in on the back end to see where your numbers are at. But essentially the most important things to take away is you have to work at least 5 years and you have to work at least 870 hours each of those years in order to become what's called vested in the pension, which means that when you retire, you'll get that benefit. So, let's say I'm starting this job today. In order to get this benefit when I retire, I would have to work at least 5 years. But if I worked 5 years and 1 day at this job, I could quit and I could go have a bunch of other jobs and do a bunch of travel, do whatever, and I'd still get a benefit when I retire. But if I worked longer, that benefit would get even bigger. But I think it's something really important to think about, especially if you're starting off in one of these jobs is, oh, if I work here just 4 years, I won't be a part of this pension when I retire. But if I make it to that 5-year mark, then I become vested. Does anyone have any questions specifically about how to become eligible for this benefit? I'll take a look at the chat too, see if there's any questions there.
So does the 5 years like start now or like once the contract is like negotiated, or is it like people that's been here for 20 plus years are already vested?
Yeah, could you tell what job do you have and where do you work?
My name's Tatiana Dixon. I'm a Huck at Methodist Hospital.
Awesome. Okay, yay. Thanks so much for joining. Um, well, I'll just announce it here. The Hucks at Methodist just recently voted to join the union. Congratulations to the Hucks. And I know we've got a couple of you all on the call. So yours is going to be a slightly different situation because you're bargaining your first contract right now. Um, and essentially your your time at Methodist will count towards vesting. So if you've worked a couple of years, you won't have to start over with 5 years, but your previous time won't count towards your like benefit amount. It just counts towards your vesting, which I know is really complicated. And we'll talk more in more details about that with just the Hucks. But essentially, your past years of service will count towards your vesting. So if you've worked 4 years as a Huckett Methodist, you only need to work one more year to become vested in the pension, as long as you win that in your contract. Does that make sense?
Yeah, it makes sense. Thank you so much.
Yeah, but we'll talk more about that as we get into the weeds of contract negotiations. Any other questions about eligibility? Okay, cool. So the next question, what is the normal retirement age for the pension? So the normal retirement age is age 65. Um, if you retire once you turn age 65, you'll receive your full pension benefit. But you also have different options to retire earlier or later and then 65, which change your benefits. We'll talk about late retirement first. If you choose to work anytime beyond 65, um, you can retire at any time and then you'll receive your full benefits. There's some specifics about if you want to retire and keep working, and we'll go into some details about that later. But essentially, if you're like, I want to work until I'm 67 and then I'll retire, that's great. You won't get your retirement benefit, your pension benefits until 65. But then starting at 65, whenever you retire, you'll get your full benefits for the rest of your life. If you want to retire early, that's a slightly different scenario. And you can retire starting at age 62 with this pension. And the way that it works is that you'll get a slightly smaller benefit each month, um, depending on how early you retire, because essentially you're getting paid for some extra years. So they're just spreading out that benefit over more years. So you can see here, let's say this is just an example. If you were going to get $100 a month when you retired, um, at age 65, if you retired at age 62, you would start getting $82 a month and you would get that for the rest of your life instead. And that's just spreading that benefit out over more months. If you retire at age 62, you would get 82% of your normal retirement benefit each month. If you retire at 63, you get 88%, and 64, it's 94%. So essentially, you would get kind of the same amount of money over the course of your life. It's just being spread out over more months. So 62 is the earliest you can retire and start receiving these benefits. 65 is the normal retirement age. Oh, this is an example of what I just said out loud, but with more complicated math. I'll skip that. because I just did the other one, but essentially you would just look at what your normal retirement amount was and you'd multiply it by the percentage for the year that you want to require or you want to retire, and that's what your monthly benefit amount would be. So another important question we get a lot is, does this benefit transfer? The answer is yes. So this is a really cool benefit of this pension plan, is that if you are working at one facility as an SEIU member, like let's say you're currently employed at Children's Hospital as an SEIU member, and then you want to go work somewhere else, like you look at one of the Fairview jobs or one of the Alina positions, that benefit, your pension benefit transfers with you, as long as you're going into another position that participates in the pension as well. So if you've worked at Children's for 2 years and then you go work at Fairview for another 3 years, you would become vested in the pension as long as both of the positions that you're in contribute to the pension. James, I see you have your question up or your hand up. Do you want to come off mute and ask your question?
Yeah, my question is just, I guess more of a comment. The only difference is, like, I saw the numbers 62, 63, whatever. Social Security to get that, you got to wait until 67. So I think that everybody needs to understand that part of it too.
Yeah, I'm not an expert on Social Security, so I won't be able to answer all of those questions, but what you can know about the pension is that you can start getting the pension benefits as early as 62. You may choose to retire earlier than that if you can, but you would have to use other retirement benefits. Like if you've been contributing to a 401k or a 403b, you would use those for your first few years of retirement. And then when you turn 62 is when you can start receiving benefits from the pension. And then you'd have to do your own research on the Social Security. I don't know about that. But thanks for raising that. So, and we'll talk about that a little bit later, but essentially this is going to be one part of your retirement benefit. You will get Social Security, you'll get your pension, and then hopefully most of you have been contributing to a 401k or 403b, and you'll also be using that. And all of those things together is what will result in a very fun, happy, healthy retirement for everyone. Um, Anything else you wanted to add there, James?
Nope, that's it. I would just wanted to make that little comment because it's
Totally. I
important
appreciate it.
when you
Thank
get
you so much. Okay, so back to talking about transferring. This is what I'm talking about is if you like immediately quit one job and then you go work at another job and there's no break in between those. If you work one job and then you quit and a couple years later you get a different job, there's some different rules there. I'll show you at the end of this call where you can find what's called the summary plan description. That's a big long document that has anything and everything you would want to know. So if you're thinking about leaving and then coming back, you'll want to make sure you check that out to get all the details. But essentially, if you start somewhere and you move immediately somewhere else, you get to take the pension with you. I know that some of you maybe eventually are in school to become nurses, and this pension does not transfer to the M&A pension. So if you become a nurse, and you become part of M&A, that's a totally different pension. And those are separate benefits, but you can absolutely become vested in both of them. Any questions about transferring between positions? Cool. Okay, so then, the big question is like, how much money am I gonna get when I retire? And the answer to that is, oh, it's complicated. And so, what I highly would recommend you all do is you create an account online. I'll show you a screenshot of what it'll look like in a second, where you can see what your current monthly benefit would be. But I do have a table that gives you all some ideas. And so I'll walk you through this table here. You can also always find this table on our website. So let's say, for example, now we're assuming in this that you're working at least a 0.7 FTE. That's kind of what I'm saying is it's complicated. So these numbers will not be perfectly matching up to your current job situation, but it can give you a rough estimate as you start planning for your retirement. So let's say you started working today and you worked 5 years and you stopped working in 2030. And then you either retired then or you quit and you worked some other job until you retired. Whenever you retire, and this again is assuming that you're retiring at age 65, then you would get approximately $175 a month every month for the rest of your life. And so what these other columns are is we're multiplying it by 12 to get to your annual income. So if you work 5 years, you get about $175 a month, which means annually from the pension, you get a little over $2,000 from the pension. Not enough to live on, but it was, this was just your job for 5 years. And it's definitely nice to get about $175 every single month as an addition to whatever other retirement benefits that you have. And what these columns are over here is calculating in total what your benefit amount will be, depending on how long you live after you retire. So again, the pension is you get a set monthly payment every single month for the rest of your life. So if you worked 5 years and were getting $175 each month, if you lived for 10 years, so you lived until you were age 75, in total, you would have received $21,000 from the pension. Now, if you lived 30 years and you are, let's quick math, 95 when you pass away, in total, you would have received $63,000 from the pension. And that's something that I think is so cool about the pension is that, it ensures that regardless of how long you live after you retire, you have you'll be able to have a dignified retirement for that entire time because you'll keep getting that monthly check every single month for the rest of your life. And then we'll just look at the other end of the spectrum. So let's say somebody started their job in 1990 and they're about to retire this year in 2025 and they worked 35 years. So most of their career, they were working in an SEIU position at a facility that paid into the pension. They could expect that their monthly amount would be about $1,000 a month, which would then be about $12,000 annually. And so again, if they lived about 10 years, they would in total receive from the pension $122,000. Or if they lived all the way to 95, they would be getting up close to $366,000. Whoa, the mouthful. But I think for the purposes of this fixed monthly benefit amount is the most important column to look at. And what I'll say, we talked earlier about every time we do contract negotiations, we try to negotiate to have our employers contribute more money into this. So these amounts surely will go up as long as we're getting our employer to contribute more money into our pension accounts each time. So that's another reason for the it's complicated number. But I think it is helpful to kind of get an idea of what the range would be. And then you can start planning on, okay, if I'm hoping to work here 10 years, I could expect to get about $350 a month. So because of that, how much money do I need to be putting into a 401k in addition to that, so I make sure I have enough money to live on when I retire? Does anyone have any questions about this table?
I do.
Yeah, holler at me. What's your question?
My question is the amount that's going in to our pension that our employer is putting in, is that comparable to the percentage they're putting into the 401k for those employees who are non-contract. Did that make sense?
Yes, that question made sense. I can't totally answer that because every facility we have different, like the non-contract plan is different and it always varies. If you wanted to look at the specific non-contract plan for your facility, a lot of those also require you to like match them in order to get those amounts. And so you're having to put some money in order for them to put money in. What's awesome about the pension is you don't have to put any money in order for them to put money into the pension. They're putting money into the pension for everybody. And then you also still have the option to contribute to a 401k or a 403b. And at some of the facilities, like some of the Alina facilities, they also do match up to 1% of the amount that you're putting into a 401k and on top of the pension. Yeah, does that, but I can't speak to
Yes.
the exact specifics of your facility. But does that help answer your question a little bit?
It does. It does. It kind of gives me a spot, the 1%. To look at the amount of what they're contributing, just their part of it.
Yeah, totally. And with the pension, they're putting the same amount of money in for every single worker. With a 401k or a 403b, they're usually contributing a percentage of your income, and that's based off of usually it's how much are you putting in and matching it for the non-contract plans. Okay, I see a couple other hands up. Um, Mark, you had yours up first. What's your question?
I just want to make a real quick comment on the difference between the pension and the 401k, 403b. With the pension, and I'm getting very close now to probably being forced to retire. With the pension, it's a guaranteed monthly amount for the rest of your life. With a 401k or a 403b, you have a set amount that is available to you, but as you draw down, you're eventually going to run out of those funds and they will be gone and you will have nothing. So with the pension, it's actually a much better, a more guaranteed retirement for you as far as your income after retirement. So it's a good secondary plan to have a 401k or a 403b, but the pension is far more valuable in the long run for everyone, no matter how much you're getting.
Oh, we should hire you to do this presentation. I don't need to be doing this. Thank you. Yeah, thanks so much for bringing that up. Yeah, it is, and I'll talk a little bit more about the differences between them in a little bit, but yeah, thanks for adding that, Mark. And then someone else had their hand up too. I can't see it anymore, but whoever had their other hand up, feel free to come off mute now.
Yeah, that was me. Um, it's been a while, but I do remember at least for Fairview, uh, Riverside, you can go on the intranet and look at their match calculator. If anyone who's curious, I think it's available to anybody. I'm not sure about other facilities, but at least at Fairview Riverside, you can go on the intranet and search for 403b match calculator, and it will tell you what it is that, at least at our facility, what you will get if you contribute a certain amount.
Cool. Awesome. Thank you. Okay, speaking of going online, there's a way that you can go online to check out your specific pension benefits. So this is Crystal, as who many of you know. This is a screenshot of her current what it looks like when she logs on to the pension website. Crystal, if you wouldn't mind, could you put that link to the pension website into the chat if you haven't already, just so folks can click on that on their own time. But essentially, Probably a bunch of you have already made accounts on here, but if you haven't, I highly recommend that after this call you do that. And they already have as long as you're participating in the pension already, they've got your information in there because your employer has been putting money in there. And so you can go online, you'll put some of your personal information in, and then your account will pop up. And when it does, it'll look like this. And so I wanted to walk you through it just to show kind of like what it's going to look like. So Crystal is vested in the retirement. So if she quit this job today and, worked some other jobs or traveled a bunch or just worked in her garden for the rest of her life, whenever she retired, this is what the numbers we want to look at here. So if she quit her job today, when she retired, she would get $450 a month from the pension. And Crystal, can you remind us how many years have you been working at SEIU?
About 15.
15. So that's a good example. If you work in about 15, you'll get about $450 each month when you retire. And then as you can see, they're calculating it each year. So again, we were talking about how many hours do you need to work in order to get the benefit? So because Crystal's always worked more than that 1,400 hours, she gets one full credit for each of those years. If she had a year that she worked, more than 870, but not up to 1,400, then you would see a decimal amount here. And then we can see, what was the rate that the employer was putting money in on her behalf. And we can see in total how much they put in on her behalf each year. And then over here, we can see the benefit grow every single year. So if she had quit in 2023, she would have gotten $415 when she retired every month. And 2024 is 450. And so then once she hits those once she finishes working 2025, that benefit will go up. So I really recommend checking it about, at least once a year or so to make sure, you can see how much money is being added into your account and what your benefit is. So that the thing you're seeing at the bottom where it says current pension benefit at normal retirement age, what that means is if you stopped working today, that's what you would get at age 65 when you retire. Does anyone have questions about this website? Have folks been able to go on there? Any questions about what it looks like when you get on there? Cool. And we'll hang around a little bit after the call. So if you want to try to log on while you're still on the Zoom so you can make sure you can get on there, that would be great. Okay, so now we're gonna fast forward a little bit to the time when you retire. And there's a couple different ways that you can get your monthly benefit depending on if you are single or not married, or if you're married when you retire. So if you are not married, or if you opt into what's called the single life annuity, you will get that full monthly amount every single month for the rest of your life. So that's, the amount that we were seeing here would be that full $450 a month for the rest of your life. And then whenever you pass away, nobody gets any additional payments on your behalf. And so this is the standard setup for if you are unmarried, but if you are married, you can also opt into this if you want to. You just have to fill out a little extra paperwork on that. And then if you are married at the time of your retirement, there's a couple different options. So this is the default option for you, and this one's called the joint and 50% survivor annuity. And what that means is the way the setup is that you get a little bit less money each month But the understanding is that if you pass away, your spouse is going to keep getting money for the rest of their life. And for this one, it's 50% of your monthly benefit. So this example down here is, let's say when you retired, you were going to get $800 a month. If you're doing this plan, which essentially is making sure that if you pass away before your spouse, they'll keep getting money for the rest of their life, you would have a slight reduction. You'd be getting 90% of your benefit. And so you would actually get $721.80 each month. And then if you passed away before your spouse, they would continue to get $360 or 50% of that monthly benefit for the rest of their life. So what this is doing is making sure that, you know, if you're married, that it makes sure that your spouse is going to be taken care of if you happen to pass away before them. There's another option you can choose, which is it's called the joint and 75% survivor annuity. And so essentially what this is it's meaning that you would get less money each month. So with the same example, you know, we've got $800 a month. With the last one before, you would get 90% of that benefit to get $721. With this one, you would get 86% of that benefit, so $688 every single month. But if you pass away before your spouse, they would get 75% of that benefit, or 516, which is more than the 360 for the rest of their life. So that's something that's going to be important for you all to be thinking about. For those of you that are married, is do you want to opt, you know, you can still opt into this single life annuity. Your default will be the joint plus 50% survivor annuity, or if you want to, you can opt into the 75% survivor annuity. Any questions about this part? And I will say that whenever you hit retirement age, you'll have to fill out a bunch of paperwork. And this is something that you'll make that decision at that point about what benefit you want, depending on your relationship status at that point.
Is there a way we can get a copy of this so we have an idea? Because like I said, I got probably 10 years left, so I can really think about it and consider
Absolutely,
it.
yeah. So this recording is going to be put online afterwards, and this presentation is also going to be put online. All of this information as well is in that summary plan description, which is already online. All of you can access it. But at the end of this call, I'll share my screen and show you where you can find it on our website as well. So yeah, this will all be available so you can, I know it's a big decision to make. And so you'll want to make sure you take the time to think about it before you retire.
Right. Thank you.
Yeah.
Hello?
Yeah.
Yeah, my question to you, my name is Mustafa. I work for Fairview Riverside. I retired already. I'm retiring right now, but I'm still working.
Okay.
And my question to you is, for my pension, to be like 70, then be collect my pension?
Sorry, can you say that last part one more time?
I said when can I collect my pension? Because I'm still working. I'm 68 right now. I'll be 68.
Mustafa, I will answer your question. Let me wait till the end of this presentation
Sure.
and I can show you, we can look up your specific situation. It's a great question. And I'll show you where we can find the answer to that at the end of this call. So I won't forget it, but in case you think I am, bug me at the end of this call, but I'll show you the answer to that.
Sure.
Cool. Great question. Okay, so now we're gonna kind of go into some more like frequently asked questions. And other things. So I'm going to try to answer a bunch of questions that you probably have. And then again, if I haven't answered your specific question at the end of this call, no problem. That's great. We'll try to figure out the answer together. So the first question is, what happens to my pension if I die prior to receiving benefits from the plan? And so essentially what that means is what happens to my pension if I pass away while I'm still working? What happens to the money that's been put into the pension for on my behalf? And so the answer to that is that if you are married, your surviving spouse might be entitled to a death benefit. And there's a bunch of factors that go into determining if your spouse would be eligible. But there's a really important step that you all need to take to ensure that your spouse is considered eligible for this, and that's to fill out this beneficiary designation form for pre-retirement lump sum death benefits. And so what this means is filling out this form is essentially stating if I die before I get a chance to retire, I want to make sure that my spouse gets my pension benefit. And so filling out this form, make sure that process will be initiated if you pass away. There's essentially if you would have a small amount in your pension, your spouse might be able to get it as a lump sum, so just one full payment at a time. Or if it's a bigger amount, it'll be like a same monthly payment as before. Um, so I won't go into all the details about eligibility on this, but the reason I'm talking about this is that it's really, really important for all of us who are married and have a spouse to fill out this form to make sure that if something awful happened and we passed away before we retired, our spouse would get those benefits. So this is where you can find that form. So when you log on to the website, there'll be a form section, and it's right here called this beneficiary designation form for pre-retirement lump sum death benefits. So you'll have to create that account on the pension website to get to this form, but I highly encourage everyone to fill it out to make sure that your family is taken care of in the off chance that something horrible happens before you get a chance to retire. Okay, so now we're going to talk a little bit more about what we mentioned a little bit earlier about what the difference between a pension and a 401k or 403b is. So I'll start off by saying all of you still have the opportunity to contribute a percentage of your income to a 401k or a 403b at your employer. And it's really recommended that you do so. And some of your employers will also offer matching contributions. So you'll want to make sure you check into that if your employer does. It's very good to at least contribute the amount that they'll match. And so, and with the idea is that when you retire, you'll have your pension plan, that set amount of money every single month for the rest of your life. You'll get your Social Security payment every single month. And then you'll also have a 401k or a 403b. So like what was mentioned earlier, with a 401k or a 403b, you get access to that full pot of money once you retire. And you have to be the one to decide how you're going to spend it to ensure that it lasts for your entire life, which is kind of a hard and stressful thing to do. What's great about when you have a pension and a Social Security at the same time is you have those set monthly benefits. And then if it's like, oh, I want to go on a trip this month, or I want to buy my grandkids a special present, then you can use that money from the 401k or 403b to supplement those monthly incomes that you're getting. Something, we've talked a lot about benefits of the pension. One benefit that we haven't talked about so far is that a pension has a lot less individual risk. So there are thousands and thousands of SEIU members who participate in this pension, which means so many employers are putting money into this one big pot. And so there's a lot less individual risk about what happens because it's this one big pot that everyone's putting money into and everyone's getting their benefits out of. With a 401k or a 403b, there's a lot more individual risk based off of what's going on in the stock market. So I know, especially right now, the stock market, there's been like a lot of ups and downs, and it can be kind of scary if you're getting close to retirement and you're watching that money go up and down based off of what's happening in the stock market. And that's your individual risk. There's no one else who's there who's like buffering that risk. That's a risk that is inherent to a 401k or a 403b plan. Earlier today, I was talking to one of the stewards over at United Hospital who's on the board of trustees for the retirement plan. And they had a meeting this morning about, giving a status update about how the pension's doing. And the update is that the pension's doing really well. So even though there's a lot of like ups and downs with the US stock market right now, the pension is also invested in a lot of things internationally. And because it's such a big pot of money, they can invest in so many different things. And so even though there's been a lot of instability in the US stock market right now, the pension plan is still going up, which is great news because the better the pension does, the bigger the benefits are that you all get. So an image that I think might be a little bit helpful is that a 401k or a 403b is a lot like a loaf of bread. So you retire and you get handed this loaf of bread, and you have to decide how much to slice off each month to ensure that you have that bread will last for the rest of your life. And you don't know how long you're going to live. Which can be hard and stressful to figure out how to manage that loaf of bread to make sure it gets you through the end of your life. A pension, on the other hand, is like being handed a slice of bread every single month. So it's guaranteed, you know how much it's going to be, and you know the next month you'll get that same amount. You'll get that same size slice of bread every single month. So I think that can be like a little bit of a helpful analogy when comparing a 401k or a 403b to a pension. Does anyone have any questions about comparing the two to each other, the different retirement plans?
Yeah, again, 403B or 401k, it's different because that's your money.
Absolutely.
That's your money. But for the pension is my money, but same times, like what I said, sometimes bankrupts, you don't have nothing. Bye-bye.
Yeah, so yeah, with the 401k or the 403b, the risk is that, something would happen with the stock market and it would
Yep.
you would lose some of that money. With the
Yep.
pension, it's a guarantee.
Yes.
So there's some more safety in the pension, knowing that, I'm sharing the
Well,
risk with a lot more people.
yeah, but you remember what's happened in Michigan? People, their retirement, because what's happened in Michigan, remember that time, that like 5, 6, 7 years, 8 years ago? And all the retirement people there, got nothing from the teacher, from that, because they are bankrupts. If you remember that, when Bush was president that time, and remember that everything was collapsed in 80. I think is I can't remember. It's like 10, 20 years ago. If you remember that.
Yeah, I don't know all the details about that one. And we can talk more about it at the end. I want to make sure we get through all of the other questions. And
Sure.
then we can chat about those details at the end. I love the
Sure.
questions that you're asking.
Thank you.
Mark, did you have a question about the 401k or 403b, or was it something different?
Um, I actually just wanted to get in on what he was saying about the pensions losing value or being bankrupted, whatever. As a former member of the Teamsters in Minnesota here, I had a slight amount of money invested in the Central States Pension Fund. And this happened about 10, 15 years ago, I believe, that the trustees of the Central States Pension Fund for the Teamsters were investing the money in a bar in South St. Paul and lost all of our money. So it can happen. And this is when you, as a union member, should be paying attention to number one, who is on your board of trustees, who is on your board as far as the e-board members, and making certain that you're keeping track of your investment in your pension. But I'm fairly feeling very positive about our pension in comparison to what happened with my central states. So yes, it can happen. Pensions can go bankrupt or be lost in a bankruptcy decision against the unions, which happened to my father's pension. But I'm very confident in what we have as of right now today in the SEIU healthcare pension program.
Yay, awesome. Thanks for responding to that. And yeah, we can get into more details about that at the end of this once we finish the presentation, but thanks for sharing that. Okay, so let's just talk about kind of like where we've come from, where we're headed. So with the understanding that, you know, right now, in order to have a secure retirement, you're not only going to have you're going to need to put money into a 401k or a 403b in addition to your pension plan. The goal is that eventually we get to a place where when you retire, you're getting the same amount of money that you were making when you were working that you get in your pension benefits. We're not there yet. And so I'm going to take a second to talk about what it will take for us to get here. And the answer of what it will take for us to get there is also the same for what do I need to do as a group that doesn't currently have the pension in order to get access to the pension. So let's first take it back to prior to the 1960s, there were no retirement benefits for hospital workers whatsoever. So there were a lot of important things that happened to get us to where we are today that are different from the 1960s. There were those arbitration victories. There were really powerful contract fights that forced the employer to put more and more money into the pension on our behalf. There's been a lot of political advocacy. And the reason why we've won such big things in our contracts fights is because we've had well-organized workplaces with strong worksite leaders. And so that gets us to where we are today. We have an awesome pension plan, and it's still not enough alone to provide enough income for a secure retirement. And so now the question is, what will it take for us to get to a dignified retirement for all? Does anyone have any ideas of what it's going to take to get to that place where all you need is your pension when you retire?
What's mean for what was your question again?
My question is what is it going to take from all of us in order to get to that place where the pension is the only thing we need when we retire, where it's that fund is big enough so that we're getting big enough benefits, that it's the only retirement benefit that we need?
No. In the United States, no way. No
Yeah, we can
way.
get there, but the question is, what's it going to take to get there?
Pressure on
First,
the employers.
What was that?
Pressure on the employers.
Pressure on the employers. How do we put pressure on our employers?
The contracts.
Contracts.
well,
Yeah.
yeah, and good fighter, somebody can fight for you, like what, like a local 113, is fighting for everybody right now. And you want to take the union away. Look at now, everybody want to do the union, they fire them or do something about it. And this is the problem. Because when you come like a teamwork together, we can work harder to make sure everything go through. But the problem it is how you deal with them. Because right now, remember, union before is not union right now. See, union before is stronger than right now. Now everybody, look at now, our hospital, I work for Fairview. If he merged with that another hospital, that hospital, the one, they don't like unions.
Yeah. So yeah, you're exactly right. You're getting at exactly what it's going to take. It's going to take a unified fight altogether. So
Exactly.
in order to get there, it'll be those what we're gonna have to do to get from where we are to get to the place that we want to be is we're gonna have to have organized and powerful contract negotiations.
Definitely.
Yeah.
And the
And
team, the team to work it there, because you need some representative in hospital. Right now, this new generation, nobody want to represent us. Look at now, I'm retiring right now. I can't represent anybody anymore. You
yeah,
see, because
exactly. So
I'm one who put the pressure, go with them for the meeting before they fire him, then I pick a grievance and all that work. I do all that work for free. But the problem is, when you work too hard, they are everybody watching you, from the manager to the, oh, that guy is that guy, you know. He want to, you know, to make you like harder, and you like to quit, because they don't want you to go to the meeting all the time, and you speak up for the another ones. Because a lot of them right now, remember, I live in Minnesota. We have 1 million population from foreign, between Somalis and Oromo and all those people, and Hmong and everything. But their barrier language there, that barrier language, they can speak up. You see what I'm saying?
exactly. No, you're saying some very important things. I'm really glad you're on this call, and you're exactly right that it's going to take oh, someone's off mute and it's reverberating back. Crystal, if you could just mute everyone, that would be great. But it's going to take workplaces with many strong worksite leaders in order for us to get to that place where we have organized and powerful contract negotiations. And so what we'll be demanding for in those contract negotiations, number one, for people whose employers currently contribute to the pension for them, our demands will be increasing the hourly employer contribution each time we negotiate our contract. You know, right now it's 80 cents an hour. What can we get to the next time we do those contract negotiations in 2027? And then number two is win the pension every time we negotiate a new contract. So I know we have some hucks on the call right now. When we do contract negotiations, we'll be fighting to get the pension in that contract. And any new group that's organizing, or groups that have organized who haven't won the pension yet, each time those contract negotiations come up, we can fight to get the pension as well for those work sites. And the reason why we want to do this is that benefits everyone, because the more and more people in this big pot, the more and more money that's going into that pot, and that benefits everybody. Okay, I'm going to skip past this part and we'll go to a couple final frequently asked questions that I want to share with you all, and then I'll stop screen sharing and we'll just open it up for larger questions. So, can I receive my pension in the form of a lump sum payment? And the answer is yes, only if it's a very, very small amount. But by and large, you should expect that you'll get a set amount of money paid to you every single month for the rest of your life, and not just one payment when you retire. Can I make my own contributions into this plan? Nope. So we can't put additional money into the pension plan on our behalf. The only way we can get additional money put into the plan is by putting that pressure on our employers to contribute more money on our behalf. Are there any hardship withdrawals or loans that can be taken against the plan? And nope, it does not allow for hardship withdrawals or loans. So that's something that is sometimes available with 401ks and 403bs, is that if you find yourself in a financial hardship, you can take a loan out from your 401k or 403b and then pay it back over time. So that's something you can do with 401k or 403b. You'll have to look into the details on that, but that's you're unable to do that with your pension plan. When should I file an application for my pension? And so you absolutely should do it at least 1 month prior to the date you want to receive your benefits. But I recommend always that about like 6 months before you think you're going to retire, giving the pension office a call and start talking to them about what all is going to need to happen to make sure that when you retire, you get your pension benefits right on time. what happens after my applications of benefits has been processed? So essentially, whenever you're ready to retire, you'll apply for benefits. And then there's a specific pension fund office that handles all the administrative sides of things. They'll send you a bunch of additional forms to complete, including making that decision about what kind of payment you want for you and your spouse. How will benefits from the pension plan be made to me? So again, you'll get them every single month. And there's a couple different ways you can choose to like actually have the money come to you, whether it's in a bank account or a check or things like that. And you'll have to, that'll be part of the paperwork that you fill out once you finish or once you're getting ready to retire. Do I need to terminate employment before beginning to receive my pension? Yes, this is true. And so I know there was a question earlier about, I'm ready to retire. When can I start receiving my benefits? You have to officially retire and terminate your employment from the industry that you've been working in. So for you all, the healthcare industry, before you can start receiving pension benefits. After 2 months, you have the option of going back to work, but you can only do it in a very limited amount. And I'll show you in a second where you can find the information about how much you can do that.
Can I add one thing here?
Oh, I put it right here. Yeah, Crystal, go ahead.
If you're 70 years old, 70, you can continue working and draw from the pension fund. I think it's a state law is why. But if you're 70, then you don't have to quit. But hopefully you'll want to retire before then.
Yeah, so can I return to work while receiving my pension benefit? So yes, if you are less than 70 years old, you'll have to take that mandatory employment break for at least 2 months. And then if you do return to work, you have to talk to the pension office to make sure that the work that you're doing works with the pension. And so essentially, that's specifically if you're trying to return to work that's similar to what you did when you were working. If you're going to do a totally different job, like you're going to go work in a grocery store now or at a restaurant or something like that, that's different. And you're able to kind of work as many hours you want to in that field. But then, yes, what Crystal said before is after age 70, you don't have to take that break. Okay, I'm gonna stop sharing my screen real quick and I'm gonna show you a couple quick resources and then I'll stop talking and give you all a chance to ask questions. Oh, I'm seeing great things in the chat. Strength in numbers, strong, higher negotiation, strength in numbers. Awesome. I love that. Okay, so I'm going to put this link in the chat here. This is to our pension fund website on SEIU. And so this is what it looks like. You can find it under member resources. And so when you go onto this website, again, at the very top is where you can see a list of all of the facilities that participate and if there's any specific job classifications that aren't participating, they'll be noted here. Then this is where you can find the summary plan description. That's what I was talking about before. And a lot of the screenshots in this presentation are from that summary plan description that has all of the details about kind of anything and everything you might have questions about. It can be confusing language. So you can always call this phone number here to ask questions if there's something in there you don't understand. This is the website that you would go to create that account. So that screenshot that I showed you all, Crystal's screenshot, that's the website that you can go to actually create that account. Here's some more information. These are some things we went over today. And then there's also a flyer here. And this flyer has a lot of the information that we went over today, including at the end, that pension benefit examples chart that I shared before.
Yeah, that chart is kind of wrong. You need to fix that chart. That chart is something is not right there.
Oh, okay. We can chat about that afterwards. Yeah.
Okay.
And then I'll just show you what this is what the summary plan description looks like. It does 2017, but this is the most up-to-date one. And so then again, this is a 48-page document. It's a lot like one of your contracts. So I won't go over all of it, but just to show you all of the things that you can find in there that you might have specific questions about is, again, how to become eligible, what you have to do, how many years you have to work, and how many hours you have to work in order to become vested. Then again, what happens if there's a break in service? You're working somewhere and then you quit and you come back, or you work somewhere, you quit and you go work somewhere else. There's more details there. It goes into details of your retirement dates, which we talked about today, normal retirement date, early and late, and how those are all calculated. It talks about how your retirement benefits are paid, and this section goes into more detail about what I was talking about before of if you're married versus unmarried, what your payments will be and what you have to choose from. It talks more about that if you pass away before you retire, what that surviving spouse benefit will be. And again, I just really want to emphasize everyone filling out that form to make sure that if that happens, that your spouse is taken care of. This is talking about, like that mandatory employment break if you retire before you're 70, and if you want to return to work after you retired, making sure that you're still eligible, and how you have to apply for benefits and some other things. So I would say in general, if you have questions about the pension, that's the best place to go to check it out, to really get some more details about it. And then if you can't figure out the answer to that, which it's totally fine if you can't because it's confusing, the best people to call are the fund operators, and you can reach them at this phone number here, which is on our website as well. They're the experts on things.